All right, everyone, it is Friday, and what does that mean? It is time for the Manufacturing E-commerce Success Show. I am Damon Pistolka, one of your hosts here today, and my co-host right over there is not Kurt Anderson.
What do you think, David?
Today?
Don't you like my wig today? What do you think?
Yeah. Well, Kurt, imposter. Well, we have none other than Nicole Donnelly filling in today for Kurt. Kurt couldn't be with us today. He's off traveling the world. He said something about an African safari and he was going to see if he could outrun a lion. We will see. But
you know what? I think he could do it, Damon.
I think he could. I think he's
energy. Yeah, his energy for sure.
I would. My money would be on Kurt. Yeah, that lion's got nothing.
Yep,
absolutely.
I agree. Well, today we're happy because we've got Nevine here today, and we've got Amy here today, and we're going to talk about keeping your people healthy in businesses.
Yes.
So let's take it away. And I was about ready to point that way because to me that's the right direction. But let's take it away, Nicole.
Yeah, let's do it. Let's do it. Yeah, this is going to be such a great conversation. Employee wellness is so important, especially in manufacturing with, what's happening in facilities and all of the hard work that they're doing. It's so important to be thinking about how can you keep your employees healthy and well and thriving. So we're so excited to have Nevine Nass here today with us today. She is the founder of Medical Screenings Unlimited, which really focuses in specifically on providing those awesome core wellness services for employers who really want to help their employees be healthy, happy, well, and do their best. So Nevine, welcome to the show today.
Hello. You have to start with why we are dressed like this. We can't just go like, that's Nevine. Great.
It's just how we dress today, right? This is just an everyday thing.
Right. I just want to thank you for, playing part of my shenanigans. So
super fun. Yep. We are all dressed up as our Taylor Swiftie favorite era. And so listeners out there, if there's any Taylor Swift fans, put in the comments and guess.
Yeah.
Which eras do we?
I've got my plant. That's a hint. I'm dressed as a butterfly. That's another hint.
I feel like I'm pretty obvious for anyone who's a Swiftie fan. But
yeah, you're badass. You're badass.
Yeah. And I'm just frozen in time. That's all I am, just frozen.
No. We've already decided your plaid is working for you. It's working for you. All we need is that scarf.
Exactly. Well, so the first question, while people are commenting on that, guessing our eras, and you can chime in anytime on that. The first question I have for you, and this is a question that Kurt always asks at the beginning of every show, is when you were a little girl growing up, who was your hero?
Who was my hero? Oh, goodness. I want to say my mom. I know that's such a standard answer, but it really was my mom. She showed us how it was done, and she created 3 daughters. We called each other Little Women. And growing up, it was her and my 2 sisters, and she really, made us self-sufficient and independent. And she's a spiritual warrior and just really instilled. Why'd you start with this question? It's just such a wonderful time in my life that I really I admire her and where she's, how she's evolved in her life. I've encouraged her. I need to do it more that she needs to really write a book. She's got seven lives in her somewhere. So yeah, no, I'd say that would be my mom. Thanks for asking. Thank you.
So
Thank you for asking.
Yeah.
Your explanation of it, man, I can just feel it. That's great.
Yeah.
Very
cool.
She's the woman.
Yeah.
Awesome.
Nice start.
Yeah. My mom's my hero too. She's amazing. I don't know how she did it raising 4 kids and working and all that. It's amazing what moms can do and are capable of. It's great.
Yeah. I agree. Sure. I agree.
Well, let's dive in. Let's talk about Medical Screenings Unlimited. Let's talk about MFG business for 27 years. Like that is a massive milestone. Damon, what percentage of companies make it to 27 years? It's like so small.
Not very many. Yeah.
It's tiny.
I tell you, there was about 4 times where we had to do a restructure of our business model, and it was by design. I mean, you have to do you shift when the industry changes. And my motto has always been adapt or die. And so also, kind of slow and steady wins the race, really making sound decisions that, where I have still control over it, where it doesn't, get ahead of me, or I don't get ahead of myself. So yeah, I love that I've been able to, have my own business, but be with my kids. That really allowed me to all my clients knew, like, my kids came first, your events will get done, but it really allowed me to take the time off when I needed it. And my son came in once and he goes, yeah, I don't know if I ever want to be, an entrepreneur. He goes, you work a lot. He put a note on if it's before 6 a.m., go back to bed. So, because you work a lot. I'm like, yeah, but that allows me to be with you guys when it's
absolutely.
That time. So.
Yeah. Oh my goodness. And I've met your sons, well, not in person, but over Zoom.
Yeah.
And you can just,
they're the best.
They're just like really grown into such, accomplished young men, being able to see your example growing up. I can see that in them, and that they really look up to you and respect you. So it must be cool at that stage of their life.
I hope so. Yeah. You're going to see, you've got little ones still, and I love that. Every stage is so wonderful. The next stage, I'm dealing with adults now that actually look at me like I'm a person, and they're like, "Oh, I finally get what you do, and you actually have emotions and needs, and isn't that great?" I love this time in my life. I always used to say the age of 8 was the best with my boys. Once they turned 9, it kind of shifted, which was wonderful still, but 8 was still the yumminess. But this is my next yummy phase with them, is that they're young men and they see the difference I'm making, but also that they're interested in what I'm doing. So I'm excited. I hope they're proud of me. So
that 8-year phase my daughter's into, and it's just so curious, so positive, so happy all the time. It's really sweet. So it's nice.
The world hasn't really touched them,
because my 13-year-old's just becoming a teenager, and it's a whole new ball game. I can't keep up every day with what's going on. So.
I can't give advice on girls. I don't know where you're headed. I know how I was. My boys. So we're going to keep tabs with you, Nicole, to see how that 13-year-old shifts into a young woman.
Oh, yeah. Well, I love what you said about adapt or die. I think as entrepreneurs, business owners, that is so critical to that long-term success. It's just always being ahead of what's going on in the market, in the industry, with your customers, and being flexible enough and nimble enough to shift to those demands. And I love that slow and steady wins the race too. I think that's a really interesting, unique pairing there, to adapt or die, but slow and steady. Like, how do you do both of those things, right? Really well.
Being strategic. For sure.
So tell us about how you founded MSU. How did this start way back when? This was like before employee wellness was really even a thing, right? Like
it really was. It really was. I'd worked with a company. Well, first of all, I've always been, throughout my life, it was like always acquiring a skill. And even at a young age, I was like, I'm just going to do as many things as I can do until I turn 30. And then I'm going to look back and say, which do I like doing the best? But by the time I reached 30, I was a mom and I had my company already for 4 years. And so when I decided to start the company, I had kind of worked in a lot of the different, whether it was research, contracts. I was receptionist. Anything and everything I did. I was in management. I was in sales. And so that really gave me I touched on every kind of aspect of a company. So when I had the opportunity to shift from my current clients, which were doctors, and when the company I worked for closed their doors, I was like, okay, let's shift. And we were offering this service, the biometric screenings, for free. So when we did the shift, they were like you said, wellness was, it really wasn't well known, and they were or important at that point. And they were like, oh yeah, no, we don't have money for budget for that. Maybe next year. And, we have money for marketing. I don't know how you do it, Nicole, Amy. That is not my game. And so, 6 months into doing what I was doing, I kind of had this epiphany in the middle of the night. I was like, insurance companies are the common denominator. So I was able to contact them, and I kid you not, the next week I was out with Humana, then AvMed, then Coventry, all of them. They all looked at me and were like, they were using hospitals, and not to, begrudge the hospitals, but they were out there marketing themselves. It was more about, maybe they came on time, maybe they didn't, maybe they left early. We really just offered a concierge type service that really, with the consumer experience, at the top of our list. So we were able to shift probably within 4 months all of that business from the hospitals to us, which is why I haven't needed you for 27 years, Nicole. Doing the marketing, it was all referral based. I barely had a card. It was all referral based. So I was really proud of what we accomplished with, always having our reputation be the number one thing that we relied on. And that was how I made decisions. Like, I'd rather a client walk away saying, oh, that was a great event, and not get a receipt or an invoice for 2 people that were non-members. I'd rather just eat the cost than have them walk away with that feeling. So I think that just really played into the idea of, like, listen, people just want to work with us, and we're going to do it right. And you can count on us being there. So,
well, you say that you don't like marketing, right? I mean, that's a drop the mic moment for sure.
Yeah.
Drop the mic.
Yeah. I couldn't. You
say that you're not great at marketing, but that is great marketing. The most foundation of successful marketing is delivering a great service and having a great reputation.
It was an introvert's way of marketing.
Yeah.
There you go.
I'm going to sit back, and for years I would wear glasses. So I felt like I was hiding from people. They're like, "No, we see you. We see you."
Yeah. Well, tell us a little bit about specifically, because I know to build your business in the beginning, you're offering what's called biometric screenings, which requires relationships with healthcare professionals. And so I think that says a lot about you, that you've been able to really cultivate really great relationships with these healthcare providers that you can trust, that can deliver the service for you and on your behalf. So tell us a little bit more. What is a biometric screening for our listeners out there who maybe aren't familiar with it, or maybe they've seen, like, in their company posters about it? What exactly is a biometric screening?
Right. Well, in a simple form, it's a collection of laboratory tests that will give the individual a clear picture of their overall health and risk factors. And so those screenings will assess a risk for developing what is called metabolic syndrome, which is a cluster of conditions that occur together, increasing your risk of heart disease, type 2 diabetes, and stroke. And so if you have an increased blood pressure, increased blood sugar, high triglycerides, large waist, and then also a low HDL. If you have 3 or more of those, you're considered at high risk for those factors. And so, really having the people understand, it's not just you're getting your blood pressure done; it's collectively the blood pressure, the waist circumference, the blood work, and so being able to kind of put it in a manageable a way of understanding, like, if you have, these risks lead to these things. And so if you don't, hoping they're making changes based on the information they're obtaining from us.
Yeah.
Love it.
It's a lot. I like that you're including the waist circumference, because I think there's a lot, we look at BMI, you can look at BMI and you can look at somebody that's got, almost no body fat, but their BMI is all screwed up because they're a bodybuilder or something like that.
Right. And that's a concern for sure.
Yeah. Good stuff.
And the thing is, like, when people, with your point of the bodybuilder, like the lean fat mass, and, when we're out there trying to do the, the body fat machine, for me, that's not a number that I like to obtain, because there's so many variables that, unless you're doing, the same person's doing the calipers, or you're doing like submersion in water, it's a number that there's the value, if you're dehydrated, it's going to be off. And so I don't tend to lean towards those. And so your point of the waist circumference, listen, we can't do anything about our height, right? You're longer than you are taller, but so you try that one on. You're longer than you are taller. Yeah. Your waist circumference is what you really can adjust. And that is how your BMI, shifts.
Very cool. Well, how is, this is so good and so important, health and wellness and prevention. So tell me a little bit about, how is a biometric screening different than just someone getting their physical? Like, why would a company, want to contract with your company to do biometric screenings at their facility or offer it separately, rather than just relying on employees to just get their annual physical? What is the advantage to doing the biometric screenings?
Well, so biometric screenings are preventative, where the annual physical is going to be diagnostic. We're not doctors. More importantly, we're not your doctor. So when we're out there, we're giving them a snapshot of where they are in that moment. So when they go to their primary care physician, they're getting a full workup. They're considering their family history, other factors with making recommendations and diagnosing them. So seeing MSU or companies like MSU, we're really the gateway for them to their doctor's office. It should never replace a visit to their doctor's office, but it allows us to, help them to, hey, are the changes I've made working for me? Do I need to shift my medication? Like really kind of giving them a glimpse in between their visits to their doctor's office. So I think that's the two of the most important.
I love it. So your physical that you get at the doctor is all about, diagnosis, all of that.
Right. And we're about preventive.
Is preventive education and almost like a catalyst for these folks that maybe aren't getting their annual physicals as, every year like they should be. But if someone's actually coming to the workplace, if someone who works on the plant floor, for example, and it's just right there for them, they just have to go in, during their lunch break or whatever and get this done. Right. It's such a great catalyst for them to be able to be like, wait, I need to go to my doctor and get this checked out.
Right. Yeah.
Or even just how am I doing? Right. If you're trying to do something year over year, how am I doing? I mean, because you don't have that kind of thing. Yeah, you get your weight at the doctor, we do that, but that's that in your blood work. But it's not the same kind of thing. If you had that in between check, it would be a lot better.
Yeah. I agree.
Cool.
So what do you think are some of the reasons or advantages for companies offering this type of service for their employees? Like, why would a company want to invest in this? What are some of the things that you're hearing from your clients about why they're doing this? What's important to them when they're thinking about their employees?
What I think it comes down to so that you have an educated, healthy employee workforce. To Damon's point, like we've gone our entire lives to the doctor, oh, you're fine, don't worry. And then you leave. I mean, they have such limited resources at this point. I mean, we all see how many times we wait at the doctor's office. Yes. They don't really have the time to sit and kind of explain and go through what HDL actually is. And so working with companies like me, we're really there to fill in the knowledge gap with evidence-based, not diagnostic, but evidence-based information. So we have them as a captive audience and are there to answer their questions when there's an information breakdown.
I love that. So as part of your service that you offer, not only are your staff that you send out to these employers performing the screenings, but they're also providing some education as well, correct?
They are with as much as we know that it's, listen, it's a liability for us to be, hey, start exercising, eat flaxseed oil. We can't be making recommendations. So it's really, we're limited with what we can state, but really just kind of focusing, like I said, on the metabolic syndrome. It's a visual picture. We have them, listed of like, these are the factors and you fall within these categories. I mean, it's really, it comes down to visual a lot. And in most times people will be like, oh, I know what cholesterol is, but like, what are triglycerides? And so we're not going through a whole, every test and going through all, it's really more the higher ones, what they ask us for. And then we also have the ability to have a nutritionist on site with a table that they can then go, after they see the screening, the results, after the results, they can then go to get their additional questions answered, more specific. But so we have different options. There's different tiers of what we can offer.
Yeah. And I love that. Go ahead. No, you go.
Well, are these kind of once a year? Or you have programs where you're going to go, hey, let's kick it off, and we're going to start a challenge or something like that. And then it's going to be like 6 months later, or how does it work? Because that's kind of
it depends. It really depends on what your goal is. Like, what are you trying to achieve? Are you get a baseline with the biometrics, which is why it's so important, and then from there creating programs. And if you have a very robust wellness, consultant on site that's creating, monthly or quarterly, competitions or engagement opportunities, they're going to want to see if their efforts are actually making changes. And so they may do it every 6 months. With insurance companies, a lot of times it's like annual. And then with whenever we go on site a second or third or fourth time, we're doing makeup days. We're trying to collect the people that weren't seen the first time around. But yeah, I think that it comes down to, each group and what their goal is, really. And if it's incentive-based or outcomes-based.
Yeah, very cool.
What does that mean, incentive-based or outcomes-based for our listeners? What is an incentive-based?
So incentive-based, we have a group that we're working with right now, and they're getting $900 for just participating. Nothing else to do with the results. But I know that what they're doing is they're taking that information and they're going, okay, we're creating a baseline. We want this data to create a baseline. And it's being uploaded into a wellness portal that is then going to be more robust for them to, pull information down and be engaged in. And so then the other thing would be with evidence-based, what was it? Incentive-based and then outcomes, is that if it's outcomes-based, then you are, you get rewards points or incentives, rewards for how healthy you are, right? So one is just for participating, and then the other one would be for your actual results being, part of the scenario.
Yeah. And I imagine the HR teams that are involved in creating these wellness programs, it's just like so much complexity in terms of how to set that up and how to structure the wellness program. And this biometric screening part that you're offering is just a small piece of kind of that overall package that they're trying to craft and put together for their employees. So, what do you recommend to companies who maybe haven't invested at all in a wellness program, or maybe they're looking at their existing wellness program and saying, I want to see what I can do to kind of like really take things to the next level. What would you advise for a company who's really like just trying to get started, first of all, and then those companies that are like, I'm not sure what I'm doing is working. I want to try something.
Yeah, the number one thing I would say with any company across the board, and I really want to kind of focus on the manufacturing companies, what we can do, but with any company across the board, don't be throwing good money after bad. You really do need to do a needs assessment, meaning you need to reach out to the individual member, employee, to see what moves them, what motivates them, and then create programs based on that. It may not be just things that are happening in the office when they're there.
Yeah.
They may be like, we're rock climbing. You can, create a program for that. Get engagement on that. Oh, I love plants. We're going to go to this plant festival, and then we're doing, 5K runs, and we're going to do sponsorship. It really depends on what resources you have to give to this. And then when we're talking about like the manufacturing employees, unfortunately, they're the least likely to, next to truck drivers, that will participate in a program like this, because they are on the line. They don't have time to be pulled back. It's more about productivity. So when speaking specifically to the manufacturing groups, I would say that depending on your resources and the size of your group, I would recommend that you hire a wellness consultant to create a strategic wellness program that, now hear me, is that it has top-down acceptance, meaning that the higher ups have a commitment to the HR teams creating a wellness culture and allowing them to have flexibility and creativity with shift schedules and changing, which allows the member or the employee to participate. We go out, and my teams, for instance, my company, we go out, and if my teams are on site for longer than 6 hours, they get a half an hour lunch break. They get their 15-minute breaks or anytime they need a break, but it's it's a half an hour lunch break. And so when we have groups that are like, we don't want you stopping. Well, how do we do that when we need this lunch break? So we, throughout the years, we've added, okay, well, if that's the case, then we have to hire more staff on that day to fill in during the rotating lunch break. Yep. We're not going to go down. And so, if they have the resources and the higher up saying, let's go hire a couple of extra people, get them on the shifts so that they can relieve them and maybe float through. I mean, that's just one idea, but it's just getting creative to be able to have them engaged and taking part in what your efforts are.
And then when you look at most manufacturing operations are multi-shift operations or something like that. I mean, you can strategically adjust your shifts or do things to be able to allow the time for people to go through a biometric screen. It just takes a planning around it. But I tell you, when being in a couple manufacturing plants over the years, the benefits of this are tremendous, because we're not talking about the average age of manufacturing now. I don't even know what it is, but it's high, right? It's not like 20 something, it's like 40 something.
Right.
And we're not talking about people that can have the luxury of time to worry about their health later. So you talk about all the different things, right? So if I'm on the manufacturing and I'm doing whatever, and I get in a little better health, how many less days does that mean that I'm not able to work? How many days, how much more productive am I? Because I do walk a few miles a day now, and I'm not as tired when I work all day. I'm less prone to strain muscles, all these kind of things. And that's where I think manufacturers and construction and places where people are on their feet and move around have to think about this even more, because the alternative of not doing something like this, with taking this biometric data and really helping your people become healthier for themselves first and foremost, because the thing with safety in the workplace is you're hurt there, you're hurt at home, and we don't want to be hurt at home, and we can just be, by getting healthier, we can live a better life, not just work more, right? That's so cool what you guys are doing.
Well, you hit a good point. And, in the last 20 years, how wellness has evolved, because when I started, like Nicole said, I mean, it really wasn't, people weren't really known. They weren't really paying attention. But the companies started when they started asking themselves, like, how can we reduce claims and empower people to take care of themselves? The wellness infancy of lunch and learns, hand washing demonstrations, trendy blood type testing, even massage has evolved into a more strategic plan with programs that can produce a meaningful return for both the group and the individual. But that's where the evolution really shifted and started. Give them something tangible where they are involved and accountable for their own health. So I think that is when the onus shifted from the group or the insurance company to the individual, and rightly so. That was something that needed to happen. So it's really putting the accountability on the individual. So, like you said, healthy home, healthy work. It's
so good. Love it. Oh, Damon, your mic went out.
Oh, sorry. I bumped my mic. Sorry, but this is where honestly we have the opportunity as businesses to help reduce our overall costs and have our people getting healthier. I mean, you don't have the double win like this very often, where people are better, your company bottom line is better, and with a larger insurance, when you have larger pools of people, if you got a few hundred people in your company, you're probably using private medical insurance, which this kind of work will drastically reduce your costs.
Oh yeah, absolutely. Crazy. Yeah, if you're paying attention and seeing what your efforts are doing, I mean that gets you budget for the next year. I mean, but it's really being able to but again, be strategic, needs assessment, start knowing what what their needs are. What is it? Yeah. Love languages. We've talked about love languages before. Really understanding who your people are.
Yes, it's so true. And meeting them where they are. And it seems like that's kind of the direction that wellness has been taking over time, is just really meeting people where they are rather than bucketing them into this very constrained, like this is wellness, but rather identifying where they're at in the journey and providing the resources to help them get them involved in things that they love and want to do, rather than, kind of saying, okay, well, in order for you to get this incentive for this program, you got to do XYZ things. We'll give some flexibility, build some flexibility to that program.
Yeah. And that's the thing, that you cannot legally make a wellness program mandatory, but you can do things. I mean, look at us today. We're dressed up in theme. I mean, my most favorite companies are companies when you show up and there's this energy and they're in superhero costumes and all the artwork is geared around this whole theme. I mean, hello. So I think that's just one little thing but those are my most favorite companies when I show up and go, you're wearing a pirate mask. It's like these people are it's so much fun. And people are like, what are they doing over there? And so I think that, it's just little things to get people engaged, but it's exciting. It's exciting.
Yes, it's good fun. And I could see, I mean, to Damon's point earlier, how valuable it is to be able to do these biometric screenings year over year. So as a company, you can start to see, how is my overall population improving, changing? What are some of the risks I'm seeing? And how is it, that data can be really, really powerful from just an entire population health management perspective to see what other, interventions do we need to think about adding to our wellness program to really help address this trend that we're seeing over time. So that's really exciting. That's really cool.
Yeah. And biometrics is under the umbrella. Like, we are really just a small piece of it. There's just so many other things that, will segue in that'll, you do one thing and it leads to another thing. So, we by no means are the end all to what you need to do for biometrics, but it really is important to create a baseline.
Yeah. And I love too what you said about manufacturers, that like, manufacturers who are thinking about this and how they can make it work with, their shift schedules and all of that, is just how can they bake some flexibility into that process, so that they give all of their employees, make it easy for them to do the screening, so that they're not like, well, I only have my break from these, so I'm just not going to be able to do it.
I'm going to eat lunch or coffee, or I'm going to get my biometrics. You can't, it's like one or the other. Yeah. So you're right.
Yeah. And what are some other things? I know you provide on-site biometrics where you'll send your team out to the facilities. It's just so convenient from that perspective. But what other types of biometric screenings options do you offer in addition to the on-site?
So in addition, so we can offer, with the shift with COVID, like home test kits were just kind of like an idea in the cloud. But when COVID shifted, it happened, we needed to figure out how we could still get the employees tested, because their premiums were based on, the data. And so we shifted to do home test kits, and we've got most of our, in South Florida, most of our people are back. So there's not a lot of remote work, but, so it's on-site, home test kits. And then I'm trying to think, and here's the thing: if you have a large group that has like clinicians on site, where it's like they have their own little community, we can give kits to them where they can, administer the test for the individual when they come in, because you can have like monthly meetings with a nutritionist, and that'll be part of their, and they don't want us coming out and testing one or two people. It's something that we can give the power to the groups to implement the screenings themselves. But we don't get a lot of that. It's really going to be on site, and then home test kits for people that are in remote satellite locations, or people that couldn't make it to the actual on-site event.
Yeah, I think that's so important now with just how many people are working remotely. Even if you're working for a manufacturing company, not everyone is working at the office on the floor. So you got to be able to provide those flexible options for those folks, so that they have an opportunity to participate too.
Yeah,
Cool.
Exactly.
Yeah.
So good.
Yeah. So what are some of the things you've been at this more than a few years? So these people that have participated for a while, so you're going, I'm measuring biometric data, and Damon comes into you for the first time, and now Damon's coming to you for the 5th year or the 10th year. What kind of comments do you get back from people? Do they say, this is my speedometer as to how I'm taking care of myself? What are some things that people say?
I will tell you, so many times we've had people, they're like, oh, my doctor's here. No, we're not your doctor. We see people over and over again. Yeah. And, for us to be tracking their years, they know the importance. If they're coming for 10 years straight, they know the importance of why we're there. Listen, they get a break. They're not at their desk for maybe 20 minutes, because they kind of did a pit stop somewhere else. But, our screenings take like 10 to 15 minutes. But when we're seeing the people time and time again, and we see the change and the impact it's making on their lives, and I'm not going to get into it because I'll cry, but we've had, in 27 years, we've probably had 3 people that we looked at and said, you need to go to the hospital now. And, pinky swearing with my staff that they're giving up their truck, that they're going right then. And we lost one. We lost someone within 24 hours of seeing us. That was something that I was like, emotional. But it's something, we're making a difference. We're making a difference. And seeing those people time and time again, if their lifestyle change is shifting and they're happy, we know that we've made a difference. Yeah. And so there's only so much we can do on site. But again, for them to have, the biggest issue is really getting people engaged. And in Damon, if we're seeing 10 people every year, 10 for the last 10 years, we've accomplished our goal.
Mm-hmm.
We've accomplished
That's a good
goal.
point.
Yeah.
Just them being there. Just them being there for 10 years.
Yeah, showing up.
Yeah, they've made it a healthy habit, right? It's become a habit for them. Anytime that you can get them to develop that as a habit that they're consistently doing over and over again, that's, I can't second that enough. I've actually been at screening events like this many years ago, former life, where we've helped people realize that their blood sugar was completely out of control. They had no idea whatsoever. Yeah. and they, you know, get them to a doctor right away. And it was really a catalyst for them to really just, and the appreciation that they share, they're just like, I am so thankful for this information. Information is so powerful in that way. And especially for, you know, those folks that aren't going to the doctor regularly. So it's really exciting to be able to be part of that, to see the life-changing impact that these screenings can have for folks. And to be a part of that is really cool.
Well, and you you mentioned one thing about these several people that you said, hey, you need to go to the doctor now. We don't realize over time, if our body is changing slowly, where we are really at, right? And no matter, you look in that mirror, every day, doesn't look much different than yesterday. But if you look from year over year and you're seeing this, or you come in and you've not done any of this before, it is such a blessing to be able to get that information when you need it.
Right.
Because
it's a tap, tap, tap on their forehead. Hello.
Yeah. It's a ticking time bomb for some people.
Yeah.
And
it is. And your point is that you're a frog in water and you're slowly boiling and you don't notice it. So, I mean, that's an excellent point. Excellent point.
Yeah.
Yeah. I mean, it's true. I mean, the leading cause of death and chronic disease in this country are primarily preventable. I mean, most of them are preventable. And if people would, you know, which I think is really exciting, because I think employers are seeing that, recognizing that the earlier that they can have these interventions with their employees earlier in their life, then and help them develop those healthy habits early, it's only going to help improve down the line.
Yeah. If we could just get less of the smoking areas outside of our buildings. I'm just sorry. I just have to go on one. But you know,
let me go on a rant.
Yeah, it's just sorry. I'm not going to go there, but you know, this is a healthy habits, right? We aren't going to eat the best.
Well, now it's so hard with the smoking, is because they were like, oh, it smells. But nowadays, I mean, you've got the vaping and there is no information out there right now that has been collected. They haven't been around long enough to know the harmful, what it's going to do to us. And so. And for so long, smoking was like, oh no, it was marketed as, you know, cowboys and cool guys. And I mean, the vaping, and you don't even smell it. It's like, so just people.
It's just a part of it, though, you know. We're slowly but surely with the testing like you're doing, we can see the effects of these kind of habits on our life. Health.
Know your numbers.
Yeah.
Well, Amy,
I'm going next week.
Good for you.
Going next week.
Good job, David. I got to go this month too. I was just saying, it's time. It's that time. It's time for me to get my physical. Well, Amy, I want to bring you in here and have you talk a little bit about, you know, Amy's really been supporting Nevine, providing content marketing support. So really helping to create content for her website and for all of the places where, you know, her social channels and all of that, just to help educate potential consumers and prospects about the value that employers have, the value of doing these screenings that employers should have. So Amy, I'd just love to get like your perspective, like what is it that you think is so important about what Nevine's doing, and what she, you know, how content marketing is such a great strategy for her to help, you know, educate and bring awareness to the value of these programs.
Yeah, I think just even thinking of myself, like I didn't know what a biometric screening was before I started working with Nevine. So I think having content out there that explains, like you just did for the past 45 minutes, like what it is and why someone needs it, like that they can just read and be like, oh, like I didn't even know this was a thing that I needed. And I feel like that's, and then distributing it using like the new social channels and your new website to do that is just going to help educate.
I'm so excited. You guys are amazing. I love Amy and her vibe. Like you and I gel. I mean, Nicole and I, you're my soul sister, but you are my Swiftie. You are my Swiftie, Amy. We were going to hairstyles. We're going in October on my birthday in Miami.
I think that's
she's amazing.
Testament to Amy and any great content marketers to really understand who it is that they're writing for.
Yeah.
The brand voice, and making sure that you can capture that essence of Nevine and her brand that she's built over 27 years, which is very, I mean, look at that. It's so unique.
Brava.
Amazing. And so I think for anybody who's considering marketing, that is such a key part to successful marketing and branding, is making sure that your brand voice is authentic and speaks to you. And as content marketers, that's what is so critical. A critical part of that process is making sure we really deeply understand that brand voice so that we can help you bring it to life. So it's cool.
I think now too with AI, like you have to, the brand voice and like making it sound like a person is only going to get more important. Like you have to identify as who you are. And like you said, that energy that people bring, that's what makes that's what draws them to the events. That's what's going to draw them to like your content too.
Yeah,
exactly.
Yeah. Yes. Thank you, Amy. You're a gem. You are a gem.
And from the other side of that, though, being the person that has a business, you have to think about your brand voice. You have to physically put characteristics, think about them, and then put them around, how you want to sound. And it really is. It's a strange thing for us on the other side trying to figure this out sometimes, because we're just us, right? But we want to. We have to.
This is your dream. This is your vision.
Yeah.
Trying to capture that. Yeah. Well, Amy's definitely done that.
That's cool.
For sure.
Bravo, Amy.
Good job.
Bravo.
Good job.
And I love your brand voice, Damon. It's awesome. It's just so refreshing. I call you the Zen master. So I think what's really cool is like the better that you can get at conveying that brand voice, it's like people who you are, you're educating and teaching people about who you are so that they're self-selecting to want to work with you because they already know you,
Yeah.
And so when they do reach out to you, Nevine, after all this content marketing work that, Amy's doing and building for you, by the time they reach out to you, they're already sold. They're like, I love what you're putting out there. I want to work with someone like you. And, that makes the selling process so much easier because it's not like this old school traditional, we're going to cold call you. And, it's like they're coming to you because they're just attracted to your
and I'm not, it's like, if you don't need my lover.
You gave it away. The spoiler.
You gave it away.
We're going to get to that. We're going to get to this very soon now.
So Amy, Nevine, this is kind of like she mentioned earlier that this is her first, she's never had to really invest in marketing before. For 27 years, she's built her business, which is remarkable in and of itself. Yes, it is. Right. But Amy, I would just love your advice for companies who are just like, really like, you know what, we've really got to amplify our voice and really get ourselves out there. If you're just getting started with content marketing and just trying to get started, what are your recommendations for companies on maybe the types of content they should be thinking about creating, the topics, and how they should go about creating content? What would you advise?
I would say know your audience and your customers. And I'm sure they, over the years, whether they have content or a website or not, like they have a sales team who is getting questions, or a customer service team maybe that is getting questions, probably the same questions again and again. And then base your content on that, how you can equip them to say, like, instead of having to type out the same answer every single time, say like, oh, here's an article about why you need a biometric screening once a year. And then they can just send it and let those people educate themselves. I always recommend The Ask You Answer by Marcus Sheridan. And they recommend the big 5 blog topics, which go into price, comparison, reviews, best of, and one other that is escaping me right now. But that's always like a good basis to have. And then you have 5 pieces of content that you can redistribute and share and kind of go from there.
Love that. So true. Answer your customers' questions. That is so key. So you don't have to write it over and over again, and figure out how to repurpose that content in different ways. So, like one of the things we like to do is make it an interview so we get video from it too, right? So like how can you create it in different ways to kind of meet people where they are and kind of get the message out in different ways is really cool. We love Marcus Sheridan. Oh my gosh, he's amazing. I just interviewed him on the podcast and it was amazing. Yeah. So anyone out there, I'm doing a shameless plug. Okay. Shameless plug. Go watch the podcast, Tales of a Misadventure. You can hear Marcus Sheridan talking about what's next. Okay. Anyway, that was shameless, but I had to go there. So very cool. Go ahead, David.
So we're at about 17 after the hour. We kind of have to think about wrapping up here. And I do have to ask,
No.
Yeah.
what is with, I mean, you're all looking great today.
You're like, what
But
is this?
there's something going on with the three of you. And
And
I'm secretly
you.
dressed.
And you.
I'm just gonna
Yeah.
I'll say that. So let's hear it. Let's hear it.
Go ahead, Amy.
What?
This is yours. I mean, you can go. You're going to explain it better than I can.
We are all one of Taylor Swift's album eras, so we all dressed up to match the vibe of the album.
There you go.
Yeah.
So Amy, which are you then?
I'm Lover. The cover of the album is like a sunset rainbow, so I have my little heart earrings and my rainbow.
There you
And
go.
of course, this
Love it. Love it.
Mm-hmm.
And then Nevine, which are you?
I'm a hot mess. I'm also Lover, the butterfly and whimsical. Actually, Amy can probably describe it better, like what Lover means.
Well, when she announced Lover the album, I'm going into nerdland here. She had painted this like a humongous butterfly mural in Nashville, and it just like appeared one day, and everyone was like, "What is this?" And that's how she announced the Lover album.
Love
There
it.
we go.
Love it.
All right.
Nicole.
So this is like my alter ego, because you guys know I am just like always sunshine and rainbows, right? Like
You are. Your
sunshine,
positivity
rainbows.
is, yeah.
So I was like, I got to embrace my alter ego, you know. So I am the Reputation era. I've got my snake earrings on. I'm in a revengeful mood today. I'm ready to like take revenge.
Very kind. You've been very kind. Yes.
You're gonna leave that piece of trash on the street when you walk by.
Oh, that's so funny.
Damon, you know
I'm not picking that up.
You're such
today.
a rebel. You're such a rebel.
Oh man, I'm not even going to tell you the most rebellious thing I've ever done in my life. You'll laugh. You'll be like, oh, that's
Yeah, but now I want to know.
Yeah, now we need to know. Come on, what do we have? 10 minutes
my
left?
Gosh, I'm
Yeah.
not sharing that on this.
Yeah, no, please.
Stay tuned.
Oh,
Yeah, we'll do that after.
Let's-
We'll do that after.
oh man. You know what? I'm embarrassed because there are some pretty rebellious things I've done that I have not done.
There you go.
We all
Much
have.
worse than
Yeah.
picking up
all.
trash on the floor, I promise.
Yeah,
Not picking up trash.
let's don't even go there right now.
Yeah. I'll let- now, Damon, I would love to have that conversation to know about.
Yeah.
Anyway,
Yeah,
we're
off
getting-
air we could talk about it, but it
We're
might be a long time.
Yeah.
So, and then me, of course, I'm stuck in the
You-
80s, 1989.
You are? 1989.
1989.
Yeah.
Living
Yeah.
it proud. Loving it.
Doing it.
Love
Doing
it.
it.
Thank you all for coming and dressing up. This is awesome. I love it.
Yeah. This
Love
is
it.
so fun. Had to do this
Yeah.
for you, Nevine. I mean, come on.
Yeah.
For
Yeah.
sure.
It's been so great learning about this because, we really need to think about how we can help the people in our businesses, not just for the business sake, for the people's sake of it, right? Because far too long we've looked at business as, people can be numbers, they're getting things done and things like that. And the more we realize, if we bring them in and get the entire person engaged and we're thinking about that entire person holistically, family, home, health, all these kind of things that we're trying to really improve or help them improve. Things like this biometric testing is just another way to help the people become healthier over time and enjoy a more fulfilling life. So it's good stuff.
Exactly.
You're here. I think that was such a great way to. What a great and Damon, you're just awesome. My gosh, I can tell you've been doing this a while. So
Thank you for being gentle.
yeah, I do have.
Good.
I do have one question for you, Nevine. Looking ahead.
Mhm.
Where do you see? Because with COVID, employee wellness shifted dramatically. But as you look ahead to your industry, if you look ahead to what's next for employee wellness and biometric screenings, and what is it that companies should be thinking about? What is the next frontier for wellness for their employees that you see that's kind of rising up that's going to be?
Yeah. You know what? I think you nailed it. And I think for me, I mean, there's so many different things. There's always shifting, and if we can follow the trends, who has time for that? But really recognizing it. But I think for me, what's most important is mental health and mindfulness.
Mm-hmm.
You know, back in February, I don't know if you guys remember, right before COVID hit, February 2020, Cigna, I think. Cigna did this whole mental health campaign. They had Queen Latifah, Nick Jonas, I think they had Ted Danson, and they were talking about the correlation between the body and the mind. And it was the first time I'd ever seen it out there, like it wasn't taboo, talking about mental health and mental issues. And, you know, we would all come to realize how, you know, after with COVID, how important our mental health is. But I will tell you, the top of her game, Simone Biles, she pulled out of the Tokyo 2020 Olympics, stating that she was, you know, putting her mental health first. That was huge. So across so many platforms, normalizing mental health is a number one priority. It has to be. I think another trend would be technology, but geez, we've been doing this. It's a slow burn. I mean, everything we're on right now talking on is obsolete. Everything is shifting. And so, you know, with wellness portals, if you're engaged in something like we talked about, incentive-based or outcomes-based, getting a wellness portal that will allow the individual to track their rewards, track their upload whatever, but then also fitness devices. I mean, we have Fitbits and, you know, Apple Watches, and my girlfriend Candace, her daughter Peyton, has a glucose monitor on her arm where her mom can see from work. You know, it's the technology, and it's always we're just hitting. It's the tip of the iceberg, really. But again, adapt or die, people. Adapt or die. So yeah.
And I imagine, I mean, it just popped in my mind right now how AI is going to continue to shift this whole thing too. I mean, that's going to be
exciting.
Really
it's exciting, but we really need to grasp and understand that. If Trent was on this call, he could really kind of talk about the concerns of that. He's been kind of, you know, in that, you know, we've talked about it, but it's exciting, but we need to really understand more about it.
Yeah. I mean, I just heard like some doctors, for example, they're saying that with AI, the AI can basically replace doctors in certain situations, and that they're able to get better diagnostic results from a lot of the diagnostic procedures that are being done. With AI.
Well, you know, so telemedicine, COVID really catapulted us. We were on our way to doing this. I mean, telemedicine was huge. We could have kiosks and go in and put the camera on your skin, and they can do blood pressure, everything's uploaded. So we really were, before COVID, to your point, we were there really, but it really just kind of fast tracked it. And so they're never going to be obsolete. The doctors are never going to be obsolete, because it's like the idea of like, with the hospitals, med clinics opened up because they're trying to handle the overflow from the hospitals and the doctor's offices, going, okay, we can't get in for an appointment, it's not an emergency, so going into a med clinic. I mean, that's how this industry has evolved to assist with the overwhelmed, you know, healthcare system. And so they'll never be gone. Doctors will never be gone. But yeah, you're right. The technology is going to be such that flying cars and
who knows?
Who knows? Who knows?
You never know.
We watched the Jetsons when we were younger, right, Amy? You know, the idea of like this thing just popping up and it's a pill and you're fed a 6-course meal. I mean,
my husband would love that.
No cooking.
He would love it. I would be like, what? I want to taste an oyster. I want to taste a chocolate chip.
He wants to feel the slime. Yeah. No, of course. No, that's what it tastes like. This pill tastes like a chocolate. Oh, it's warm and it's gooey. It's a chocolate chip cookie. Come on, technology. We can make it do anything we want, right?
That's true.
Yes, you can do a lot with it. You can do a lot. Well, Nicole, as we're wrapping up today, final thoughts?
Final thoughts. I just want to commend you, Nevine, for what it is that you've built over the last 27 years. And just if we take a minute and just think about just the thousands and thousands and thousands of lives that you've impacted because of the work that you're doing. And the impact, you know, that is just such a massive impact. I mean, the people that you screened 30 years ago now have children, right? And that hopefully, I mean, you'd hope that it would help influence them and that kind of a thing and continue that path forward. So let's just take a moment and just think about the cool impact that the work that you're doing has had on so many thousands of people over the years. And I just have so much respect for that, for what you've built and for your commitment to helping, you know, build healthy populations and all of that, and what a pleasure it is to just work with you and serve you. So thank you so much. Keep doing what you're doing. It's
Thank you for your words of affirmation. You know me. It's down on my list. It's down on my list.
I know.
Yeah, no, I tell you, imposter syndrome at its best. But no, thank you very much. It's very kind. Yeah, and again, we are just really we're just a small little knot in this whole, wellness, umbrella. So really, I'm happy to be a part of anything my company, my groups are creating, and anything they need, I'm there for it. So
very cool. Yeah. Awesome.
Exciting.
Amy, any last words from you? Lovely lover.
No, I think you summed it up pretty well. I think we can leave it there.
Nice. Very nice.
Damon, you get the last word.
All right. Well, I want to thank all the guests that are dropping comments today. I'm going to miss some names here, all the way back from Karen and Ivan and Marius. There's so many in here. Chris and Amy and Dr. Levine and Anakin, Ahmed, Mohammed. We had so many people in here today. Thanks so much for dropping the comments. We appreciate you. We appreciate you dropping a comment. We appreciate the listeners that are stopping by. And even if you're not dropping comments, you're driving in the car, at work, whatever, be safe though. And we'd love to have you around every week. Nevine, thanks so much for being here today.
Thank you for having me. This was fun.
Just a joyous occasion to have you here. So great to talk to you. And Amy, for driving the Taylor Swift's theme today. Thank you.
Doing it proud. Taylor would be so proud.
Yeah.
Always count on me to bring.
I think someone needs to send this to her. We need to send this to her.
You know what? Yeah, we got to take a picture.
There you go.
Okay.
Get a picture of this so you can send it to Taylor.
Say thank you.
All right. Well, we're out for this week, everyone. Wonderful. We will be back again next week with the Manufacturing E-commerce Success Show. Hang out for a minute, everyone, and we will finish up. Have a great weekend.